We are joined today by Shai Almani. Apologies for that pronunciation. Shai is a program lead for the Neuro and Stroke PIN, and she's just here to give us an update. I will turn it over to you, Shai. Thanks again for joining us today.
Thanks so much. Can everybody hear me okay and see my screen as well? Awesome.
We can't see your screen yet.
Oh, you can't see my screen yet. How about now?
I can see her screen.
Yeah, that looks
good.
good.
Perfect.
Oh, good.
Yep.
Okay, awesome. Well, first of all, a big thank you for allowing me to be here to give you a bit of a brief update. As Casey said, my name's Shai Almani, and I work in the Neuro and Stroke Provincial Improvement and Integration Network. And I'm excited to be here to tell you about one of our projects, which is spinal cord injury quality of care. And so really with respect to scope of our project, it's really related to acute care. The Neuro Rehab and Vision Strategic Clinical Network a couple of years ago had done a quality of care review about the care that patients with spinal cord injury receive. And there were some things that we felt we could improve on. And one of those was the early treatment that this patient population receives, making sure that their injury is identified and that they receive surgery within the right time frame, as well as receiving post-operative care. So our job here in our project is really to develop a provincially accepted SEI care pathway. And we're really focused on from injury identification to post-operative care. So really looking at some of that upfront early patient pathway piece, particularly in acute care. One of the things that we have worked on doing over the last few months is establishing a provincial best practice recommendation for accessing surgical decompression within 24 hours in the province of Alberta. And then we're also identifying the appropriate utilization of specialty care teams across various levels of trauma centers across the province. And then finally, what we want to do is we want to hand over a pathway for operational teams to implement and make sure that that gets spread across the province. This is what some of our project timelines look like. So a really sort of tight time frame within a year or less, we are trying to complete a time to decompression recommendation, which we're very close to being there. And then we want to give ourselves some time to complete the draft pathway, the upfront early pathway. And then we need to make sure that we provide teams with education on that pathway and transition the pathway to clinical operational teams for implementation. I just want to tell you a little bit about what we've been able to sort of accomplish between when we started in November up until now. So we have a final draft recommendation of Alberta adopting a 24-hour surgical window for spinal decompression. We've also, in order to do that, we've identified some barriers to decompression. What are some of those factors, whether it's transport or access to diagnostics, that are really impacting not being able to achieve that recommendation? And so that is that's going to drive our build of a pathway. And then we're also looking at the various levels of trauma centers and their competencies and capacities associated with being able to provide care to patients with spinal cord injuries. The other thing that we've done is we've drafted a plan for utilizing CNEs and others in SCI sites to really consolidate some of the spinal cord injury information that's out there into a bit of a customized package for sites depending on their level of care around spinal cord injury. And then finally, I think this is a really big, important piece that really helps us determine whether or not we're accomplishing the goals we've set out to achieve, and that is developing a data strategy and a dashboard. And so we have done a lot of work to identify traumatic patients with traumatic spinal cord injury. So really identifying the right cohort of patients that we're building our pathway for. And we've developed draft timestamps on that dashboard. So we have things like, how long did it take to get to the hospital? You know, what was sort of that time of arrival in emergency department? What is that time to CT or to MRI? Also, what is the time to OR? So really building a dashboard that tells us some of those timestamps. And then our project ends, like I showed you in the timeline above, towards the end of this calendar year. And we want to make sure that we develop a sustainable plan for evaluation after our project is complete. So we want to leave behind a bit of a dashboard when we're finished, and we want to make sure that the right patient population is in that dashboard. And so we're getting an opportunity to do things like explore language learning models in order to do that, and to do that effectively and sensitively in our dashboard. So I know I'm already at time. We do have another project that's very closely related to SCI that I want to just flip through in 30 seconds or less. We also have a pressure injury project that's underway in the neuro and stroke PIN. And so what I will do is I will share these slides with the organizers so that they can be sent out. But we have my Learning Link modules on pressure injury prevention and the Skin Plus model. And then we also have a community of practice with the acute care bundle improvement initiative that really houses all of our resources related to pressure injury prevention. So I will stop there because my 5 minutes is up, but I'm absolutely available to you via email if you'd like more information or would like to ask me questions. I'm definitely not alone on this project. I work with many others, including Chester Ho and Margaret Grant, but you can connect to them through me as well. So thank you again so much for this time.
Beautiful. Thank you so much for that update, Shai, and thanks for joining.